FAC provides both ABA therapy and private school services. We have children who come to us for one or both of those services. If your child's preschool aged, then they're not old enough yet to participate in our school services. However, they would be a perfect candidate for our early intervention services. If your child is at least kindergarten age and you're interested in school services with FAC, then there's an opportunity to coordinate care so that your child gets both their school services and their ABA therapy services all wrapped into one.
The school program matches to the best of their ability the curriculum for the Florida Sunshine State Standards and the Common Core curriculum. We're able to use applied behavior analysis to teach the goals and the core curriculum that is provided for the Florida State Standards. And so we're able to use smaller ratios at the Florida Autism Center to get most of the clients up to their academic level so that we can hopefully transition them back into their school placement.
Some of the things we're going to want to find out from the parent is any other services that your child might be receiving, that may be speech, that may be occupational therapy. It's very important to us that we try to coordinate our care with those other service providers so that everyone's on the same page. While we aim to be clinically excellent and experts on ABA, we recognize and value the fact that you'll always be the expert on your particular child, and we will not be able to provide as quality a service without that collaboration.
We want our families to be involved, and I always tell parents that it's great if your child comes here and does these beautiful, wonderful things for me, but if you take them home and they don't still persist in doing these things, then we miss the mark. So we want our parents to enjoy these successes with us and to be a part of that. And so to do that, we bring our parents in sometimes weekly, but at minimum monthly. And they sit down with us, we go through the program, we talk about what problems are we having at home, what strengths are we having, and what new things are we seeing that we're really pleased with. And then we talk about how do we make it better? How do we make it even better? How do we make your life easier at home? How do we take the things that we're doing here and make them functional and useful in your day-to-day life?
Something that's great about having your child come to a center to receive their ABA services is you can get the best of both worlds. So your child will have a one-to-one therapist available with them at all times, but we're also going to structure their day and their activities around group activities so that they do get that very important peer socialization component.
This is the point in the tour where we discuss particular skill deficits and skills that are related to your child. So we'll talk about the family eating habits, the child eating habits, any allergies, any medical conditions or medical needs that your child might have. We'd also discuss sleeping habits and daily routines so that we can develop a treatment that is specific to your family and your child.
Because we structure the child's day and we structure their activities, we embed opportunities for them to work on a variety of daily living skills that are going to help with their functional independence. So a perfect example of that is toileting or toilet training. That's a problem that we see often, and a request that we receive often from our parents is, please can you help me with toilet training? And the answer is yes, absolutely we can. That's something that we have great interventions for. We do incorporate meals into the regular daily schedules of each child, so usually that means a morning and afternoon snack and a lunch in the middle of the day. We do not provide the food, but we help with food preparation. We're very conscious and aware of children who have any specific food restrictions or special diets or food allergies. It's also another opportunity for socialization. So we group kids together, they eat lunch together, they talk to each other, they help each other out, everyone pitches in together.
A therapy session will typically look like a child arriving in the door and a therapist comes out to greet them and may exchange a few words with their parents, take them back into a therapy room where they'll sit down at a little table and they will do some tasks together one-on-one. The tasks that they do will be based upon the child's program, which has been created based on assessment of what are the child's current skills and what do we want the child to be able to do. So they'll work together for a few minutes and then they'll take a break to play, and then they'll come back to the table, work together a little bit more. Usually about an hour they'll be with one therapist, and then they'll go see someone new to keep kind of a fresh perspective and keep everything moving along and exciting for everyone. The child may come and do some social skills group then, so there may be certain times during the day where we say, let's bring everybody together in one room, and we sing songs and we read stories and we do the things that you would see in more of a typical preschool classroom. But when we do that, each child in that classroom still has a one-on-one person to guide them through these group activities and make sure that they're getting the most out of it that they can. So throughout the day, a child would have a schedule that they'd follow: time one-on-one, time spent in a group, more time spent one-on-one, new therapists to see. It's an ever-changing, ever-moving kind of day to keep it really fresh for all of our kids. So most of what we do is one-on-one therapy here. So when you look at a classroom here, what you're going to see is not 20 or 30 children in a space. You're going to see 2, maybe 3 children, each with their own little table, with their own little station. You're going to see a therapist and a child sitting together, working together, laughing together, and then taking breaks to socialize with the other kids in the room. So you're really going to see that individualized attention and that time spent on this child and what does this child need.
Florida Autism Center has created their own data collection system, and in doing so, we're able to collect live data.
It really is a way to guide the progress and to kind of know if we're on the right track. We can see daily if we are making the strides that we want to make, and we can adjust our program accordingly if we look at the data that we're collecting.
So each of the staff members has a computer, and the system has all of the programs and all of the data from all of the previous days and keeps track of changes across time, and the therapist is able to collect accurate and reliable data by using this data collection system. In addition, it has a parent portal, so parents are able to log in from home and see how their children are doing at the center that day. It's really important to have live data collection because it improves the accuracy of the data, so you get a better picture of what the children are doing, what they're getting correct or incorrect, or how much problem behavior they're having, because the therapists are not having to rely on their memory of events that happen. They are able to immediately plug in the data and put it in there, and it graphs automatically, and it leaves little room for human error. We spend a lot of our day with the children, teaching them appropriate play skills and teaching them how to interact with their environment in an age-appropriate manner. And so we have a lot of natural environment teaching that happens at the Florida Autism Center, and in doing that we give them access, we give all of the children access to the types of activities that they would see in a lesser restrictive placement. We teach them how to interact with toys, and we teach them how to interact with other peers interacting with the activities that we have available for them. We also use play as an opportunity to teach social skills and to teach appropriate behavior when children take their toy or children aren't sharing with them, and how to take turns. We have recess time where we're able to work on gross motor skills while they're engaged in play, and we can enrich their environment in such a way that their environment matches what they would likely transition back into should they transition back into their general education placement. For a lot of the children and a lot of the families, some of these real-world situations that they are exposed to are really difficult for them. So, for example, haircuts or going to the dentist or going to the grocery store, those all might be problem areas for the family or for the child. So what we do is individualize their therapy to allow them access to practicing the skills that they need to go to the dentist. So we'll set up an environment at the clinic that looks just like their dentist's office. We'll go to the dentist's office and see how they do at a dentist's visit, and then we'll try and teach them the skills in their day-to-day therapy, and then we'll go back with them to the dentist and see if the skills that we're teaching them actually generalize to the setting that it's necessary to succeed in. We hope you were able to learn a little bit more about the Florida Autism Center and all of the services that we provide.